Now I'm going to talk to you about getting an epidural from a labor and delivery nurse's point of view. A lot of times I see patients in triage and I'll ask them, what are your pain management plans? Are you planning on getting an epidural? And the patient will say, no, I'm not planning on getting an epidural. And so I'll ask them if they attended any prenatal classes, and usually they'll say no. And so it's kind of like, well, they're expecting to come into the hospital and they're just going to wing it. That's like the gist of it. And so in my head, anytime I hear this, I think, well, they're probably going to get an epidural. I better make sure everything is ready. And, you know, I'm not trying to say that if you don't have prenatal education or if you don't go to some sort of class that you can't, you know, have your baby naturally. I'm just saying it's much, much easier to have your baby without an epidural or without, you know, pain medication if you have prepared your mind and, you know, your body for what's to come. So not everything about an epidural is bad. A lot of times, you know, patients will come in, especially if it's your first baby, and patients will come in and they're just like this, like they're so tense. And so sometimes whenever they get an epidural, we put in, most places will put in a Foley catheter after your epidural, since you can't get up to go to the bathroom. And so you have an empty bladder, you're no longer in pain. And so a lot of times it's kind of like your body goes, and it relaxes, and, you know, your baby is actually able to come down, and frequently, you know, patients will actually dilate. And I don't think it has anything to do with the epidural. I think it has to do with them being, you know, in a state of relaxation and you know, not so tense. And so, you know, not everything about getting an epidural is bad. You know, I've asked anesthesiologists before, you know, is it true that you can get back pain if you get an epidural? And, you know, every single one has always told me no. You know, if you're going to get back pain, you're going to get back pain. And it probably has nothing to do with the epidural. And, you know, I don't really know if that's true or, you know, what the studies are about that. I just know that a patient that asks for an epidural, that wants one, they're usually like, I don't care if you take off my, you know, toes, like, give me the epidural, you know. And so it's not, you know, you could say, oh, yes, you will have back pain. And they're going to be like, okay, I don't care. You know, how do I sit? Let me get ready for it. And so, you know, so just know that too. I have never, ever, ever had a patient say, oh my God, that epidural was so rough. I thought it was, you know, everybody always thinks that it's going to be worse than it is, but every single patient I have ever had that has gotten an epidural has been like, oh, that wasn't so bad. That's it, you know? And so I think when we watch movies and we see the needle that's like this long, it kind of psychs us out. And so don't even worry about that kind of stuff. Whenever you do get an epidural, most hospitals will not allow anybody else in the room. So it's just going to be the anesthesiologist, the nurse, and you. And sometimes the anesthesiologist will have an aide. And what's going to happen is the nurse is going to sit you up on the bed, and your feet are going to dangle off. And your nurse is going to be right here in front of you, and she's going to say stuff like, put your chin to your chest, curl around your baby, make your back like the letter C. Make your back like a shrimp. Make your back like a mad cat. Okay, and what's going to happen is the anesthesiologist is going to stand behind you, and they're going to start pressing on your spine with their fingers to kind of like feel what's going on. And whatever part they touch, that's what part you really want to like pooch out towards them. A lot of times they'll be touching, and patients will want to come like this way, but you really want to like push your back out towards them. And your nurse is going to tell you, put your chin to your chest, relax your shoulders, curl around your baby. And those are some of the things that you're going to want to do. Remember that anesthesiologists, you know, they specialize in this. They specialize, you know, in your spine. They specialize especially OB anesthesiologists, they know how to give epidurals. So, most people do not experience, problems, or, most anesthesiologists don't have problems giving somebody an epidural unless there's something wrong with your back, like you have scoliosis or you've had, some kind of back surgery. So I'm just mentioning that to kind of ease some of people's anxiety. Let's see. Other than that, the epidural, it really does take away, almost all of the pain. So, some people can move nothing, like, waist below. They can't move anything after an epidural. And some people can move everything, but they still, don't have contraction pain. As the baby gets lower and lower and lower, a lot of times people will start to feel a lot of pressure. And some people's perception of this pressure is, oh my gosh, it's so painful, and that's normal. It's very uncommon for a patient to just, I don't feel nothing. I don't feel anything. I don't feel nothing down there. What's happening? That is unusual. So it is very common to start feeling pressure, especially as you, begin to keep dilating, and, as you push out your baby, you're gonna feel something, and that's expected. And most epidurals are on a pump, and so you get like a little bit of a continuous infusion until you deliver. So a lot of people will worry about, well, if I get it now, will it wear off then? And the answer is it shouldn't wear off. And if it does, they can just put more medicine in the bag, in the pump. And, some bad things about epidural, and this is the number one bad thing about epidurals for me, is that I love for my patients to move around while they're in labor. And so once you get an epidural, most hospitals, you're then confined to the bed. Most hospitals don't have what they used to call, I don't know if they still do, call them walking epidurals. And so once you get your epidural, you are like stuck in bed. And so, there's supposedly not like an appropriate time to get an epidural, but I always tell my patients, you really want to be in pain. You really want to be hurting, especially if it's your first baby. If it's your second or third or fourth, you can get it whenever you want. You're going to deliver your baby, probably after your water breaks. But when it's your first baby, you really want to be like as active as you can before you get the epidural. So I'm not saying, wait until you're 8 centimeters, but, you definitely want to wait as long as possible so that you can rock in a rocking chair, so that you can be on a birthing ball, you can walk around your room or your unit. That's one of the bad things about epidurals. A lot of patients will ask me, is it true that my labor will slow down if I get an epidural? I don't know if that's true, but I do know that if your labor does slow down, your provider will do something about it. So, they will do something else to try to progress your labor. If you're planning on not getting an epidural, if you're trying to say, I really don't want one, if it's your first baby, I would definitely recommend, take a prenatal class, do Lamaze, do hypnobirthing, do something to kind of prepare yourself, because every single patient thinks this is the worst pain possible. Nobody else in the whole world could have ever felt this kind of pain. And I always tell them, no, everybody feels that kind of pain. It's universal. It hurts. Labor is labor because it works and it's hard. And, so, but people will say that when you are in labor, you will probably say there's no way anybody else in this whole world could have possibly had this kind of pain. But, no, everybody has that kind of pain. And so it's all about your perception to your pain and, trying to manage your pain in that way. So, even if it's not your first baby, attend some classes, try to figure it out. With your second and third and fourth baby, every labor typically gets easier, gets faster. And so, if you are thinking about, not wanting an epidural, the best case scenario possible would be for you to come in an active labor, because then it's faster and your body is like working itself out. is to come in an active labor and to have a plan, to have a backup plan, have some kind of meditation, or have something that you're planning on practicing, instead of just like, oh, I'm going to just wing it and see how long I can last, because, you may find that you may not last that long.